and I can remember 100 times, I want to go home. I gotta go home. I gotta get the hell out of here. I want to go home.
I got 11 of my friends are on the wall.
Just didn't understand why they were there. So many of them died.
In Vietnam, an injury would be like a 19-year-old that had walked into a grenade. And sometimes, I mean, half of the face would be there and the other half would just be gone. And sometimes it was full face and you wondered, I remember one of the nurses said, well, look at their toes. If they're pointing to the ceiling, they're on their back.
So you have a flashback. You just start shaking and you don't deal with it, it deals with you.
Sometimes I think if I could just fall asleep and never wake up. It'd go away.
Put you on heavy medication to where you're so sedated that you just won't bother them no more. Just give you your pills, go away, come back next month, we'll talk a little bit, get your pills, and they keep you in a chemical straitjacket.
So the civilian doctor classified me as a walking pharmaceutical. I was taking so many pills.
And I had a bad experience in 1980 when I went to a counselor and I said I wanted to talk about Vietnam, and he says, this has nothing to do with Vietnam. Let's talk about your unresolved anger towards your father when you were young.
I don't want another 10 years of this.
In 1993, the Upledger Foundation conducted a 2-week investigation into the effects of CrainoSacral therapy and somato-emotional release on PTSD in Vietnam veterans. In 1999, they completed a follow-up to that earlier investigation, this time with 4 2-week programs. The interviews you're about to see were conducted on the patients from this most recent series of intensive programs.
It seems like such a subtle thing that happens, and yet it gets down to the core.
I'm a whole different person than what I was when I came in here.
Even as scary as it is, knowing that you're going to have to face some of the demons that are there. But I wouldn't want to face those anywhere else but here.
All of the veterans at the end of the program remarked that they were feeling much, much better. Physical symptoms were alleviated. Their depression and hopelessness was greatly improved.
Probably 60 to 70% of the pain is gone. That what it was when I got here, I couldn't even walk without limping and being in severe pain. This place saved my life. That's all I know is that this has saved my life.
There's a joy that wasn't there before. There was a tension and a pain that didn't let me live. It's your life. You get your life back. Yeah.
My hope is for them to go back and recover that part of them that they left in Vietnam.
I've learned to put my complete trust in their hands. It's like being in the hands of angels. And